Welcome to the Neuromodulation Podcast, presented to you by the International Neuromodulation Society. Dive into the forefront of today's emerging neuromodulation techniques, insights, and ethical and clinical applications. Subscribe now to join the multidisciplinary collaboration of medical care providers, scientists, and engineers who are part of the global conversation that's shaping the future of healthcare.
Welcome to today's episode of the Neuromodulation Podcast. I'm your host, Mandi Soleil, and I'm delighted to be joined today by Rachel Whipp. She's a registered nurse who works in Newcastle, Australia at the Hunter Pain Specialists Clinic, where Professor Marc Russo serves as medical director. Welcome to the show, Rachel.
Thank you, Mandi, for having me.
Lovely to have you. So I'm wondering if you can start by telling us your journey into nursing and specifically in the field of neuromodulation.
Yeah, so I've been nursing for nearly 20 years now. I started my career in the acute setting in hospitals in Newcastle. So I did a mixture of medical, surgical nursing, looking after post-operative patients that had general surgical procedures, and then moved into intensive care nursing, which I was there for about 5 or 6 years. And I had a break then to have my twin daughters. So I spent about 14 months off on maternity leave before heading into general practice. I spent about 3 years in general practice and doing a lot of women's health nursing. And then I was getting a little itchy and needed something a bit more challenging. There was a job that came up at Hunter Pain Specialists, and I contacted them and applied, and it sounded very interesting. I'd never dealt with chronic pain patients before or neuromodulation, so I was extremely green. And I've been there for nearly actually 10 years now. In April, I celebrated my 10-year anniversary. Wow. And it's been really challenging, enjoyable. I'm learning every day. And I believe that's why I'm still there, because I'm challenged every day and, learning something new, especially from Marc. He's so innovative in his field, and that's what keeps me interested.
So have you been working with Professor Russo for the last 10 years?
I have, yes.
Wow, what an incredible journey.
Yeah, so we've got a great team that we work within. So not only we're so lucky to work with Marc, we have 2 other physicians that we work with, and another nurse that I have been with the whole time as well. She's been there for 12 years. And we've got a really great working relationship. We collaborate every day and learn from each other, and very supportive team.
So I don't know about our listeners, but I certainly want to know, do you have any secret insights you can share with us about what it's like to work with Professor Russo?
Captain Chaos is his nickname, affectionate nickname that we have for him. So, everybody wants a piece of him, and we are fighting the tides with everybody else trying to get 5 minutes with him. So he's dynamic and, as I said, an innovator in his field. So it definitely keeps me on my toes.
Well, with so many people seeking his time and attention, and I anticipate you're rather busy in the clinic, can you give me a sense of what the care team looks like at Hunter Pain Specialists and how you all navigate supporting patients through interdisciplinary relationships?
Yeah, well, as I said before, there's myself and another nurse, Rebecca, that I work with. She's been in the clinic for 12 years and I've been there 10. In that time, we have seen a few nurses come and go, just due to personal circumstances have changed. But there's, the 2 of us have been there in that space of time. We've got the 3 physicians, and then we also work within a multidisciplinary team. So we've got physiotherapy, we've got psychology, and we've got psychiatry, all in the one building. So we're very lucky to have access to all of those healthcare professionals. And on a day-to-day basis, we're not only managing neuromodulation patients, we're actually managing chronic pain patients who are undergoing conventional therapies as well as advanced pain therapies.
So I understand that Dr. Russo is quite busy. I anticipate you are as well, but that there's also a rather large care team that works to support patients of neuromodulation. So can you tell me, what does the multidisciplinary care approach look like at Hunter Pain Specialists?
Yeah, well, we're quite lucky that we work within a multidisciplinary team. So in the one building, we have physiotherapy business, we have psychiatry, we have psychology, and of course, we've got nursing and the medical team. And we all work together to manage those neuromodulation patients. We also manage patients that aren't undergoing neuromodulation therapies, so conventional therapies, and also run a intensive pain program through our centre. So we're quite lucky to be supported by a variety of allied health.
That's amazing. Can you give me a sense, this is a pain clinic that we're talking about here, what neuromodulation practices do you and the team work with?
So a large part of our work is looking after patients undergoing spinal cord stimulation therapies for pain. And we also manage patients that may include peripheral nerve stimulation, occipital nerve stimulation, spinal cord stimulation. So the nursing team educate the patients prior to them undergoing their procedure. We assess them at baseline for their pain, their sleep, their sitting, standing, walking tolerances, functional capacity. And then we utilise all of that information to assess them through their trial phase. If they proceed to implant, we manage all of their preoperative screening, so preventing infection, managing any comorbidities they may have. We organise their theatre date and time, liaise with company reps. And then we also manage them post-operatively. So we manage any potential complications that may happen in that post-op phase, particularly wound and infection is a big one that we're across. And we're managing their expectations, their goal setting, things like that, and liaising with the other allied health team members as well. So if there's a referral that might be needed to psychology, we can flag that and we can arrange that. And we're also communicating with the physicians and the physiotherapists and the psychologists on a day-to-day basis to optimise the care of the patient undergoing neuromodulation.
So this leads me to wonder, imagine I'm a nurse and I'm considering going into the field of neuromodulation. Can you give me a sense, if I were to go to a pain clinic such as this, what a day in the life looks like? How many patients am I working with? How much time am I doing paperwork? How do you stack your day?
Yeah, every day is different, I must say. So it is a little bit like a little mini ED triage. Every day we walk in, the day could be different. So we get lots of phone calls from patients regarding multiple things, scripts, medications, side effects. They may be in a pain crisis and they just need to they need to talk to us and be referred on, or just have a conversation with the nurse. And sometimes that's enough to reassure the patient. We liaise with GPs and pharmacists regarding patients. We'll take phone calls from emergency departments if a patient with a stimulator presents in a pain crisis, and they oftentimes in Australia it's not a common practice in public hospital setting to have a spinal cord stimulator. So a lot of the times we're actually educating the doctors and the nurses in the public health setting. So we do spend a lot of our day educating both healthcare professionals and the patients and their families. There is a fair bit of paperwork that comes with that. We're emailing back and forth between patients and other healthcare providers, and sitting with the patient and providing a lot of education. This journey of neuromodulation for patients is quite overwhelming, so they need a lot of reassurance. And the more the reassurance that we can provide, whether it be in person or over the phone, I think the better the understanding that they will have of their therapy, and the better outcomes that they will have. So we do develop relationships and quite good rapport with these patients over time, and you get to know them quite well.
How much time would you say from start to finish that you interact with a patient who's getting, say, a spinal cord stimulator?
Yeah, so initially, just to give you an idea of how the process works, and I know that it does vary from country to country, so I can only talk on my experience in Australia. Once the patient is referred for neuromodulation therapy, the physician will then give us the consent form, the referral for admission form, I guess you call it, and we contact the patient and then take over and start the journey. So we bring the patient in for an education session, which lasts on average about 60 minutes. Sometimes it can be longer, and that's where we talk about the device, how to use the device, basically what the therapy is, go through their expectations, their goal setting, talk about medications, we talk about their pain. When did their pain start and how did it start? What's a typical day like for the patient? How do they manage their pain? And we talk about those functional tolerances and their activities of daily living. We tell them about how the trial phase will work. We tell them about how the implant phase will work. So we're really trying to set up their expectations of the whole process. And that way we're ensuring that we're getting the best outcome from the patient. They're not walking in with an unrealistic expectation thinking that this therapy is going to be the magic cure for their pain. So there's a lot of discussion in that 1 hour. As I said, sometimes it goes over 1 hour. Patients tend to disclose things to the nurse that they wouldn't to the physician. They tell us everything. They feel comfortable, I think, and I'm privileged to be in this position that patients feel comfortable to disclose their innermost fears and their thoughts. Pain can bring about a lot of anxiety and depression, so we quite often are not only talking about the therapy and the practical approaches around the therapy, we're giving a little bit of a counselling session as well, and or thinking about, well, when do I refer this patient to psychology? Could they use some physiotherapy? So we're a little bit a jack of all trades in a sense. In that education session. And then after that, we support them through their trial phase. So every day they trial the system for somewhere between 7 and 10 days, and we'll phone them each day and we'll talk to them. And that phone call of assessment could take anywhere from 10 to 30 minutes. So we're trying to ascertain what their outcome of the trial is. Are they getting enough pain relief? Have they reduced their medications? Are they more physical? Are they able to engage with their family more? And then obviously after the post-operative period, where we see them quite intensively for that first 3 months while we're making sure the wounds are healing, making sure that their programming is optimal, and making sure they're following up with their physician and, getting them engaged with physiotherapy if that's what they need. And, so it's quite intense, really. If you're a patient's coming in and undergoing a spinal cord stimulator trial and implant, I would say the first 6 to 12 months is quite intense with our involvement with the patient.
Well, and granted, the impact of chronic pain can be quite emotional for patients. And it's not your essential job to be a psychotherapist, but did you receive notable training in school with respect to how to support patients through these emotional experiences? And how do you develop yourself in this way now as a clinician?
It was a long time ago that I was at university, so trying to remember that far back is a challenge. But no, you might do a little bit of, psychology 101, the basics of from a nursing perspective, but it's definitely not my skill set. So you have to develop this through experience over time. And we utilise the professionals in our building to the best that we can. So we work with some great psychologists, and I would utilise them to get some advice, and that's how I've tried to develop my skills, is by talking to those people and get some advice on how best to pick up, the something that might flag you for a patient that needs further investigation or further treatment. And but I think just being a human at the end of the day as well, these people are living in chronic pain for years, and it takes a huge toll on their life, it takes a huge toll on their family and their jobs, and just having some empathy and listening to their story. They just want to be heard and acknowledged. And I think having that compassion goes a long way.
Well said. You've spoken a lot as well about your role in educating patients. Can you help me understand how you keep apprised of the field of neuromodulation so that you're able to provide the most up-to-date education that you can?
Yeah, so education's been a really big topic among nurses recently. We're extremely lucky to be accepted and welcomed by INS to have our own breakout sessions and at conference. So that has actually really gone a long way into helping provide the professional development and education for myself. I've learned so much by coming to conference at a international and a local level through my own chapter back in Australia. So that is one way that I keep abreast of things. But I'm constantly working on providing some formalised educational handbooks for nurses entering the field, because there wasn't anything when I started. It was all learned by experience, and you just, you just try your best. You ask questions. You look for the information yourself. There was nothing formal when I first started about neuromodulation nursing. So at the moment in Australia, we're working on developing and implementing a handbook that just provides some guidelines and some education for nurses that are wanting to get into neuromodulation or who are already in neuromodulation and just want to further their knowledge. And it's really based around what the foundations of neuromodulation, managing a neuromodulation patient is. So it's the principles. And then hopefully we can build upon that as the years go. But that's where I'm at the moment as far as education goes.
Exceptional. And you speak about formalizing opportunities for education. You were instrumental in developing a mentorship program for nurses and allied health professionals through the INS. Can you tell me what inspired you to take the initiative to have that be built out?
Yeah, again, I think it's just a lot of this has grown organically through the interest that nurses who I'm working with across the world have had. They want to be represented. They want to be able to connect with their colleagues and network and learn from each other. And when we saw that there was a mentorship program, but it was physician aimed, we thought, hang on, what about us? And I'm extremely lucky that, Marc is the president, and I did have some access to him to be able to, sell my idea of it being available to nurses and allied health, and he's been wonderfully supportive of that. So I think it's an excellent opportunity for nurses to connect and to help really nourish the next generation of nurses coming through. And I didn't. When I first started out, I didn't have that. So I want to make sure that there's a legacy left for new nurses coming through, that they've got that opportunity to feel supported.
What about just do you know if globally everybody's required to have an RN? Is that a standard across the world, or are there unique implications to what sort of education you need to be a nurse across the world?
Well, in Australia, we have different levels of registration for nurses. So you've got your nurse practitioners, which is generally the highest level that you can go. Then you've got clinical nurse consultants and clinical nurse specialists, registered nurses and enrolled nurses. So there's a variation amongst qualifications of nursing. As far as I'm aware, there's no real specification on what you need, which level you need to be to work within neuromodulation. I feel like in Australia it's more clinic dependent, and because everything's run more at a private level, so private practices up to the medical directors, the practice managers on, what qualification is the essential criteria, I guess. Yeah. I believe internationally, registered nurse would be your baseline qualification to enter into that specialisation.
So earlier you spoke about some of the challenges that patients face as they're navigating the potential of neuromodulation. Can you share, in your role as a nurse, what are some of the biggest challenges you face in your role, particularly unique to neuromodulation?
I would say one of the biggest challenges is cost is a big issue for patients accessing the therapy. In Australia, it's all privately led. So it's frustrating as a nurse to see that the therapy is really only available to patients that have private health insurance or go through the workers' compensation scheme. So I do feel a huge amount of dissatisfaction that it's not available for everybody, whereas in the UK it's a different model of care and it's a publicly funded therapy.
Can you help our listeners understand, in Australia at least, how do you go about navigating things like insurance or getting coverage for these procedures? And would you say that many people are paying for this entirely out of pocket, or do they generally have support?
They are paying a premium per month to have that they have to have top level of cover through their private health to be able to access this therapy.
Okay.
As I said, there are people that are going through the workers' compensation scheme that are able to access it, but it's much more stringent, and there are a lot more hoops that we have to jump through to be able to get patients approved to have the therapy. So the delays can be quite long for those patients as well.
Are there any barriers that you could identify that have been impactful in your career? I mean, you've been at Hunter Pain Specialist for a decade now, so you have probably a decent flow going there, but is there anything that comes to mind?
No, I wouldn't say any major barriers, no. I've tried to take the initiative I'm the type of person that sees if there is a barrier or a roadblock or a gap in education opportunities, then I want to fix that, which is part of the reason why I've joined forces with a few different nurses within INS, and I've met through networking globally like-minded people, and we've joined forces to improve access to education and professional opportunities for nurses in neuromodulation. So it really it's gained momentum over the last few years, and as I said, I feel like it is growing each year, but no, I don't let roadblocks get in the way.
How would you say that the international nature of this community has sort of inspired you or influenced you? How have you developed in how you approach care as a nurse, being part of such a global field?
Well, what I find reassuring is that it doesn't matter where you are in the world, we're all experiencing the same issues. Mm. And so to hear just the simple fact of having a conversation, talking to your colleagues from Vancouver or from the Netherlands and hearing that they're having the same issues that you are, it provides such a sense of support and reassurance, and I really find that useful. Yeah.
Lovely. And then what about professional organizations? Are there organizations or networks that you particularly recommend for nurses who are looking to expand into this field or develop greater connections within the field of neuromodulation?
Well, I think absolutely getting involved with your local chapter of INS. I think that's the first place to start. Definitely. And that's where it all started for me as well. There was a few like-minded colleagues back in Australia that I worked with that were really instrumental in getting a nursing session up and running at our local chapter meetings. And I think that's where it started to really grow from. So, yeah, get started at a local level, definitely. And then come to beautiful places like Vancouver.
Absolutely. You mentioned patients wanting to have a voice, and it sounds like nurses want to have a voice as well. How do you find that the neuromodulation community is receptive to nurses and the voice that you bring to the table? And is there anything that you would really love for other professionals in this field to understand about the nurse's perspective that could help them better support the care that you give to patients?
So as I said earlier, the INS committee have been really supportive of nurses and allied health within this space. So I'm very grateful that we've been given a platform and we've really been welcomed with open arms as part of the team. And yeah, I'm very happy that it continues to grow at the rate that it does. As far as the nurses and their feedback from what I've had so far from this meeting is that they all appreciate the opportunity to get together and collaborate and learn from each other. As I said, we're all experiencing similar issues across the world, and it also gives them an opportunity to enhance their professional development and present to an audience at a professional level where they may not have done that before. So they're growing their own CV and their own skills, which is wonderful to see. And within INS itself, we've actually started a nursing INS nurses committee, or a sub-branch. So that kind of developed off the back of INS in Barcelona 2 years ago. We spoke to the board about having our own special interest group as such, similar to maybe like IWIN. And so that is in the works and growing. And it's really pleasing to see.
Exciting. What's the best way for a nurse to get involved in that?
Come to conference. Give me your feedback. What would you like to see? What topics would you like to have presented? Would you like to be a presenter? Email INS, get in touch with me that way. Yeah, I'm happy to have the more people on board, the better.
Wonderful.
Yeah.
We can be reached at ins@neuromodulation.com if you're looking to gather more information. Are there any misconceptions about the work that you do or the role of a nurse in neuromodulation that you'd like to address?
I wouldn't say misconceptions. I wonder if it's maybe not a full understanding of what we do. Some of the feedback that I received yesterday from my colleagues in the workshop is that we do a lot of invisible nursing tasks. So there's things that we do on a daily basis that no one sees. The emails that, might take 10 or 15 minutes out of your day to answer and respond appropriately to a patient, or, just cleaning that equipment, maintaining equipment, cleaning rooms, doing an admin, something that an administration role that's really not within nursing, or chasing an account that's not really nursing related. So we do all of these many varied things that aren't really seen, and it's difficult to actually log that on a day-to-day basis. So it's it's a role that's really not well understood a lot of the time.
That's really helpful to get your perspective on. I'm curious, are there any innovations in neuromodulation that are on the horizon that you are particularly excited for?
So as far as the stimulation goes, we found it very exciting working with ECAPs and seeing some other therapies such as restorative neurostimulation. So that's been very exciting to see outcomes. And also I'll be interested to see some more remote programming come into play, and artificial intelligence. We haven't really dabbled in that very much where I work, but it'll be interesting to see how that will help patients.
For somebody that is interested in pursuing a career as a nurse in neuromodulation, what would you say is the biggest consideration that they should bear in mind?
It really is an ever-evolving field. To be constantly in pursuit of knowledge, you need to be open to learning, and never stop learning and wanting to ask questions. Yeah, you're never going to be abreast of it all of the time. It's changing every day.
You were saying I'm in a pain clinic, not in a...
Oh, in a surgery, like a day surgery?
Yeah.
Yeah. So,
are you part of, do you sit in on the procedures at all?
No. So as I said before, that I work in the clinic rooms. So we're managing the patients from the clinic perspective. I don't go into the theatre to work. We have a separate set of staff that manage the theatre and assist with the procedures. So we follow up with the patients the next day after their procedure, and then we deal with any issues they might have after their procedure and manage those things ongoing.
And do you have any direct communication with the nurses that are working in the theatre?
Yeah, we do. We speak to them quite often. Okay. Yeah. So, most days we speak to them about a patient issue, or, any communication around theatre lists or anything we need to know. Yeah.
And at Hunter Pain Specialists, how do you work to establish sort of communication across all of the different parts of the care team so that patients aren't necessarily having to bounce around as much?
Yeah, so we've developed a system with the physiotherapy team. We've got a referral process, so we automatically will refer a patient who's undergoing spinal cord stimulation to physiotherapy. So they can go for a trial assessment. So we've automated that process. We try and streamline our processes so we can keep the communication flowing freely. A lot of email, phone calls. It's great that we're in the same building as the rest of our multidisciplinary team. So quite often we can just walk around and speak to them face to face, which is great. I think that takes away a lot of the difficulties being in the same building.
So can you provide any insight around, you're working with the patients most directly for the most prolonged period of time amongst the care team. Can you give a sense of, from start to finish, how long patients are usually spending in the process of, determining what device path they're going to go down all the way through to recovery?
Yeah, so they may be undergoing conventional therapies for some months before they decide to undergo spinal cord stimulation. In most cases, we've interacted with them, quite a few times over the phone or face to face. We've spoken to them after their procedures and assisted with any medication inquiries that they may have. So usually we know the patients by the time they get to that point. Anyway, so it might be 12 months, 2 years. It's difficult to put an exact timeline on how long they, have been in the clinic system before they get to neuromodulation therapy. But, most cases we know them quite well.
Are there any variables that you've observed improve the speed of recovery most for patients?
I think patients with a positive outlook, sounds cliche, but a positive outlook and realistic expectations. These are two things that I've seen. If they can understand what they're to expect from the therapy and be realistic about it and have some really good goal setting, I think that they tend to do much better in the long term. And education as well. Having a well-informed and educated patient really makes a difference.
Well, and since nurses are often doing the education and setting the expectations for patients, do you have any guidance for nurses around how to maybe notice if a patient doesn't have adequate expectations or appropriate expectations, and how you work to guide patients to get there or bridge the gap that might exist?
Comes through conversation. It really is spending the time with the patient in that, especially in that initial education session appointment that I referred to before. Yes, we allow 60 minutes, but if you need to take longer with the patient, you take that time with them, and really trying to nut out what it is they're hoping to get from the therapy. Like I said, goal setting. What specific things do they want to achieve? That will generally tell you whether they're realistic in their expectations or if they're just completely, out of the sphere of what to expect. So, yeah.
And something that I've heard come up in nursing communities is that compassion fatigue can be something that's experienced.
Yeah, absolutely. Yeah. We take on a lot of emotions from people. It can be quite draining. It can be quite exhausting. I often know when I'm ready for a holiday. And my colleague is the same. She knows when she's ready for a holiday or knows when I'm ready. She can tell. Because, as I said before, you do need to have empathy for your patients. They are going through a tough time. They've been living with the pain for years, and it is exhausting for them. But it's also we're only human, and we can take on their emotions as well. So trying to learn how to manage that is important. Yeah.
What are some of the most effective strategies you found personally that work for you to temper some of the stress that comes up?
Yeah, look, sometimes I think it's knowing when to hand on a patient. So if I'm dealing with a particularly difficult patient, or they're highly emotional or highly stressed and I'm taking a lot of that on, I need to know when to step back and when to hand that on to my colleague. And I know that not everybody is lucky enough to have a colleague that they work with in clinic closely that they can do that, because a lot of nurses I've spoken to over the last few days are working independently. So they don't have somebody to debrief with and to bounce off. So that can be tricky. But if you are lucky enough to work with somebody, knowing when to pass it on and take a break, that's quite important.
That's really helpful. Well, with all of this in mind, is there anything that we missed? Any final words of advice that you have for other nurses or other practitioners in neuromodulation to best work with nurses?
Please don't feel alone, because that's one of the universal things I've heard in the last few days, that there are feelings of isolation. They feel like they're working in a silo. And but please don't feel alone. There is a huge community of nurses, and we're hoping to just bring everybody together and know where to go to for advice. So get in touch with with your INS colleagues, get on the mentorship program, utilize the services that are there and that we're trying to build.
Wonderful insights. Well, I want to thank you so much for being on the show today. It really means a lot to incorporate a nurse's perspective into the show so that we can really build awareness around how to support this community. So thank you for being here.
Thank you so much for having me. It's my pleasure.